Injections are terrifying to patients, but one of a nurse's favorite things to do. According to Fundamentals of Nursing by Patricia Potter, Patricia Stockter, Ann Perry, and Amy Hall, injection routes differ depending on the type of tissue the medication enters. You can give an injection intramuscularly, subcutaneously, or transdermally. I'm Lexi Oliver, and I'll be showing you how to safely draw up and administer medication through an intramuscular injection. The first step in medication administration is hand hygiene. Be sure to wash your hands before dealing with any medication or syringes. Once you've done that, you're ready to obtain your medication and draw it up. Clean the top of your vial with an alcohol swab. And ensure that your needle is tightly secured on your syringe. This information is from upmc.com. Remove the needle cap and pull back the plunger to your desired dose. In this case, I'll be injecting this orange with 1 milliliter of water. So I just pulled back 1 milliliter of air into my syringe. Inject the air into the vial. MedlinePlus.com informs us that this keeps a vacuum seal from forming within the vial, which would make it very difficult to draw up the medication. Invert the vial and make sure that your needle remains below the fluid line. Pull back the desired amount of medication using the plunger. So I'm going to pull back to 1 milliliter. Tap the syringe to get rid of any air bubbles that you might have accidentally pulled up. So I have 1 milliliter of water in my syringe. Recap the needle using the one-handed method to ensure safety. Lastly, uncap this needle and get the correct needle length for an intramuscular injection. An intramuscular injection requires a 1 to 1.5 inch needle to be inserted at a 90-degree angle according to NursingLink.com. Intramuscular injections are characterized by inserting the needle into the muscle. This can be done in the upper arms, the lateral thighs, or the buttocks. This information is from drugs.com. Once you've found the site you want to inject in, assess it for any swelling, bruises, redness, and if any of this is noted, you want to pick a different site to inject. Next, you'll put on your non-sterile gloves. This part can be tricky, so you have to be a little patient sometimes. Your fingers will get twisted in there. Once you've done that, you're going to get a new alcohol swab and in circular motions clean the injection site. According to an article on inmo.e by Angelina Cocoman and John Murray, you should use your non-dominant hand to stretch the skin of the injection site. Grab your needle in your dominant hand and hold it like you would a pencil. Uncap the needle and stretch out the skin like I previously stated. Insert the needle at a 90-degree angle in one swift, dart-like motion. For intramuscular injections, you're taught to aspirate. According to the nursingpath.blog by Ian Miller, this means drawing back the plunger to see if any blood draws into the syringe. If blood is seen, this means you're in an artery or vein and the needle should be immediately removed without administering the medication. If you aspirated and no blood is seen in your syringe, you're okay to go ahead and infuse the medication into your patient, or in this case, your orange. Once infused, take out the needle and use gauze to apply pressure to the injection site. If your needle has a safety mechanism on it, you want to go ahead and activate that and then dispose of it into the sharps container. If it does not have a safety mechanism on it, you're still going to immediately dispose of it in the sharps container. cc-sd.edu reminds us that the most important thing is to never recap a used needle. This ensures patient and nurse safety. An intramuscular injection is only one of many types. I'll have to show you the subcutaneous and the transdermal at a different time. Once the patient has stopped bleeding, if they were, you can go ahead and remove your gloves. And in about 10 to 15 minutes, you'll come back and you'll check on your patient to see their reaction to their medication.